Phillip Yoo, Dr. Phillip Yoo here in Orange County, and today we're treating Adrian here, and he's contracted a herniated disc in his L4-5 and L5-S1 vertebra. So basically what's happened was he walked in a few days ago and his posture was basically like this. It was a antalgic posture. It's antalgic scoliotic posture because his body's leaning away from where the disc is protruding out. So it's a self-defense mechanism. So what we're doing here, this is called a decompressive therapy, and we do it manually so I can detect what's going on. Some decompressive machines, the doctor doesn't touch the patient at all, but I like to do it because I can kind of feel what's going on and apply correct pressure. So what I'm doing is, if this is the vertebra that's being compressed, what I'm doing, I'm decompressing it the opposite direction to create negative pressure so the disc goes back into its correct space, taking pressure off the nerve. Now, because his nerve right now is also being irritated, he has sciatica, which is the nerve that runs through the buttock muscle, all the way down the back of the leg. He does have some shooting pain and numbness down there, and by doing this procedure, by opening up that side of the vertebra, it's exact to that area. We're decompressing the pressure, and we're leaving that sciatic pain and the local pain in his back. Okay? So right now I'm locating L4-5, which is located right above the iliac crest, right in that space. How's that pressure, Adrian? Good?
Feels good.
Good. Now L5-S1, which is one level below. A few repetitions here. What this also does is each repetition we're pumping joint fluid, encouraged to go between the vertebra, so it doesn't thin out the disc space anymore. And the mobility here is also going to train the muscles around there so they don't atrophy. So we stop the mechanism, bring them back to neutral. Okay, free. Now, because this hip is higher here, right here, it's tilted, we're going to do what's called a drop technique. Even off the hip right here. Good. And one more. Retest it. Now it's moving more normally. Now this is a sideline technique. You want to roll your right side facing me. Manipulate with the belly extended because we want the low back to be in an extended position like this. When the low back is in an extended position, you're protecting the disc when it's manipulated. If it's in a neutral or flexed position, you can risk damaging the disc even more. That's why you have to adjust with the low back in extended position, because these called our Z joints actually protect the disc by locking it in place. And when you adjust it, that part of the disc is protected. Okay? So we're going to go ahead and do that. Stick your belly out again. Extend your low back. Good, good. Just relax. Good. On your back. Now what we want to do is retest the sciatic nerve, and this is called the straight leg SLR test. As we can see, it's pretty stiff below the 70 degrees, which means the lesion is most likely below L4-5, probably L5-S1. Also piriformis nerve involvement, piriformis muscle, as the nerve runs through here, and the muscle is that tender there. This muscle contracts and it mimics sciatica, which means because the sciatic nerve runs through this muscle deep in here, the piriformis triangle looks like that. If this muscle is contracted, it can mimic a disc by causing shooting pain on the sciatic nerve. So we're making sure this is not the case by stretching out the piriformis muscle. It's very tight, and he's going to do similar stretches at home. Okay? And we're just going to check his cervicals here. The whole spine is connected. Okay. And last thing, we always check the psoas muscle because it's connected to the low back. I want you to give me your hands. You can see here his left hand is shorter, which means most likely his left psoas or deep abdominal wall muscle is contracted, pulling him like this, also contributing to the muscle spasms. So we're going to do a psoas muscle release. Just bend your leg right here. Okay, just relax. Okay, just let your hip drop. Okay, just breathe in. Out. In, out, in, out. Now you don't want to put in any excessive pressure to make the patient uncomfortable. You want to give just enough pressure to release that muscle. Now you retest it. As you can see now the fingers are normal, which means now that the psoas muscle is released, now they're at their normal length and position. Okay? Alright? So Adrian, why don't you hit and sit up, and I need you to tell Mr. Hu what made you come in, and then what results you got after your first treatment, if you could just share about that real quick.
Well, at first, I've been dealing with this pain for over a month now, and I've been going to like clinics, different places that had no effect, didn't work at all for me. But as soon as I found out about this clinic, about this chiropractor over here, my first treatment over here, at night I fell asleep good. I felt pain relief. It's amazing. I felt great, and I'm gonna keep on doing my treatments here, and just recommend everyone to try it, and it's a miracle for me.
All right. And can I have you stand up for a second? I just want to show you what Adrian looked like his first time in here, and he's still a little off center. See how high his shoulder was, but it was even more. It was kind of like he was walking like this. Remember?
Yeah.
And now, you know, it's only his third treatment, so we're slowly but surely aligning his hips and shoulders. So
Yeah.
you got more good things to come.
Mm-hmm.
All right, thank you.
Thank you.